Hi everyone, I'm Brad Weehee, the CEO of Altru Health System, and I'm with Nicole Benson, our Community Relations Specialist with Altru, and Josh Kerwald, who's one of our JLG partners, the Senior Project Manager, and we are excited to take you through a video tour of our new facility.
Thanks, Brad. It's been a lot of fun working on this project so far. We've made a lot of progress. If we think about where we've been a year ago to where we're at today, we've made enormous strides in getting this project off the ground and get started. For starters, we're going to take you through a layout of this site with a model to kind of give a sense of where the new building sits on the existing campus and its relationship to some of the other buildings on campus. So on the eastern side of the site is Columbia Road, runs north to south. North is towards me on this model. This large white building in the middle of the campus is the existing Altru Hospital. Next to that is the 1300 building. On the northern end of the site is the existing Cancer Center and the existing 860 building. And in between the hospital, the existing hospital and the Cancer Center is where the clinic used to sit. And that is really where we've located the primary focus of the new hospital.
Now we will move over to the blocking and stacking, same orientation as we had over here. This is Columbia Road right here. We have our emergency room right off of Columbia Road. One of the nice features that we have with our new emergency room is we have patient entrance right off of Columbia Road. Our ambulance will come around and come in through the back. The patient entrance is through here. Coming in, we have the cutout into the cafeteria. We have 3 patient elevators and 3 staff elevators. Right off the lobby, we have our diagnostic imaging and IR. The emergency room department, like I said, is here. Moving to the lower level, like I said, we have our cafeteria. We have a cutout space for outdoor dining, allowing lots of natural light into that cafeteria on both sides. One of our prominent features that we have is we have our chapel, and along with the chapel we have great outdoor seating and green space along that chapel area.
Moving down to the lower level, again we have the dining room adjacent to the cafeteria, and then moving around the eastern wing are some further support spaces. So inpatient pharmacy, biomedical engineering, the on-call space, and then kind of at the very northern tip of the lower level on the eastern side is central sterile. And that is very intentionally located where it's at to have a direct vertical relationship to the surgical department, which is up on the second floor.
Off the elevator on our second floor, we have some outpatient services, outpatient infusion, pulmonary rehab, SPCU and PACU together, dialysis, surgery, minor procedure, and cath lab right above our ER, and an observation unit on the opposite wing. An exciting feature of our third floor is we do have the helipad. Right off the helipad, we have a trauma elevator. Our trauma elevator will fit a gurney and an entire trauma team and have the ability to go right down into general surgery if needed. Clinical laboratory and pathology, and the rest of third floor is the administrative suite. Fourth floor is our mom and baby floor. We have NICU. One of the areas that I'm excited about is we have all private NICU rooms, labor and delivery, OB and newborn nursery on the opposite wing. Fifth floor, we have critical care unit and a progressive care unit on the fifth floor, along with respiratory therapy.
6th floor and 7th floor are our typical bed unit floors. They're very similar. The difference being with 6th floor we have the dedicated family medicine and peds unit. We say dedicated because that takes some additional security requirements that we have to construct into the building in order to make it acceptable to have pediatrics in there. 7th floor is very much the same as 6th floor. Each floor consists of 2 units. Each unit consists of 24 beds, so it's a total of 48 beds per floor. And the units are arranged and laid out the way they're laid out to really take advantage of the southern and northern light available in our climates. And that's the roof.
Thank you for joining us today for this walkthrough of our new facility. As you can see, we are very excited about this 21st century state-of-the-art new hospital that is going to be loaded with technology and amenities for our patients and our families and our communities. Please join us at www.altru.org/future to give us feedback and also to see a frequently asked question list and to keep updated on the project as we go through the year. Thank you.